Hello, I'm James Ryan of Samaritan Medical Group Orthopedics, and today I'm going to be speaking about total knee replacement, also known as total knee arthroplasty. I have a model of a total knee arthroplasty, and what I'd like to highlight are the different parts of the implant. At the top of this model, we have the thigh bone in clear plastic, and in the bottom we have the shin. A knee replacement has 4 parts. The first part is a cap that's placed at the end of the thigh bone, and the second part is a cap that's placed on top of the shin. Both of these pieces of metal are held in place with bone cement. Between the 2 pieces of metal is a polymer, and that piece locks into the tray on top of the shin. So in the future, when the knee bends, it's this piece of metal rubbing on the polymer beneath. The fourth and final piece is a polymer disc that's placed on the undersurface of the kneecap, and that runs in the groove at the end of the thigh bone when the knee bends, just like this. The operation itself is about an hour and a half long. The hospital stay is about 1 day. So the surgery is performed in day 1, you spend the night in the hospital and go home the next day. We do have patients who go home the day of surgery and those who stay a bit longer, depending on their medical needs. We do a number of things for you while you're in the hospital. We start you on physical therapy. We have you work with physical therapists and occupational therapists. A variety of nurses will be visiting with you, and we really start you on the road to recovery. You'll be started on a variety of medications to help prevent complications. We will give you a blood thinning medication to help prevent blood clots from forming in the legs. That can happen with this type of surgery, and if they form in the legs, those blood clots can travel to the lungs, and that can be life-threatening. In addition to that, we'll do everything we can to help prevent an infection. Anytime surgery is performed, there's a chance of an infection, but when metal and plastic are inside, it's a much bigger problem. So we will give you antibiotics during and after surgery. We'll give you special soaps to clean your skin before surgery. We'll also check your nose and your urine for bacteria before surgery to help reduce the chance of an infection. Things that increase the chance of an infection include those with diabetes mellitus, those who use tobacco products, and those who are overweight and have excess tissue around where the surgery will be performed. Before surgery, we do a number of things. We'll have you see your primary care doctor. Before the operation, he or she needs to tell us that it's safe to move forward, that your heart, lungs, and kidneys are working well. In addition to that, we'll have you go to an educational class. In that class, you'll learn about what to expect in the hospital, and you'll be introduced to people you'll be working with. We will also get blood tests, urine tests, EKG. Also, our anesthesia providers have the tools they need to do your anesthesia safely. We prefer to use a spinal anesthesia, which means a needle in the low back. In addition to that, you will go to sleep as well, but because you'll be numb from the waist down, the sleep is much lighter, and we can avoid the use of heavy narcotics, sedatives, and gases. So you go to sleep, but it's much like you go to sleep at night. Before surgery, you'll visit with us in a preoperative visit with our physician assistant. He'll review a lot of things with you, make sure all your questions are answered, and all our ducks are in a row. In addition to that, we will prepare you for surgery most frequently with an MRI scan done at the knee and an X-ray from the hip to your ankle. With that information, we make customized instruments that are unique for your knee to help place the implants very accurately, very precisely. The other complications that can arise from surgery include fractures of the bone, damage to nerves, damage to arteries, damage to veins, changes in the length of your limb, the need for a blood transfusion, and medical complications like stroke, heart attack, and even death's a possibility, but the chance of that happening is very low. Thank you for listening today, and we look forward to seeing you in the office.